So what else is out there? What other proposals are out there? Patient Freedom Act, proposed January 23rd, 2017 by Senators Cassidy and Collins from Louisiana and Maine. What would it do? This is kind of the middle ground approach in terms of how the Republicans could proceed. It would repeal the individual mandate, get rid of the pay-or-play rules, the ESR, employer shared responsibility rules. And then it would allow states to kind of pick and choose how they want to handle health care reform. So, for example, if a state wanted to keep the Affordable Care Act, if California or New York or Massachusetts, some of the more liberal states want to keep the ACA, they could keep it. They wouldn't receive the exact same funding from the federal government in terms of the exchanges, it may be lesser, but the basic concept is, if you're in that state, you would have an ACA exchange available to you in that state, again, with possibly limited subsidies. Then the next one is kind of a default rule where if the state doesn't choose, they go into something called a market-based alternative. Market-based alternative details are a little bit vague. It talks about a skinny down high deductible health plan. So some kind of high deductible health plan with federal money going into your own HSA. So if, Wisconsin, to use an example, let's suppose that we're kind of a middle ground purple sort of state. We can't decide what to do, so we say, let's just go with kind of the default here. Individuals in Wisconsin would have some kind of subsidy to buy health insurance, go into an HSA. The HSA funds from the federal government could be used to buy an individual policy. Then finally, you have the go it alone states, the states that say, we just don't want to provide any assistance to our citizens, to our residents. We're just abandoning this entirely. So they would decline the offer of free federal money for their residents at that point. And that bill, by the way, it is kind of a middle ground, and so it's kind of suffering from the mushy middle type of approach. House leadership is not in favor of this. House leadership is strongly saying that the HCA, the American Health Care Act, is the only way forward. So they're kind of rejecting that idea out of hand. So in terms of where the AHCA came from, primarily from this. Paul Ryan, Speaker of the House, of course, from Wisconsin, has previously laid out a better way health care reform, June 2016, 37-page document, lays out kind of the basis for how he thinks health care reform should be changed here. First of all, repealing the ACA. And again, these are sort of talking points. It's not legislative text, so legislative text is hundreds of pages long. This is more talking points. Repealing the ACA. Not clear, though, under Speaker Ryan's bill if some of these things would change or would be kept. For example, keeping kids until age 26. President Trump, of course, ran on that as part of his platform, said he absolutely wants to keep that age 26. So, again, that's one of the details which isn't addressed in Paul Ryan's ideas here. Expanding HSAs. Again, Republicans love HSAs. Increasing contribution limits, catch-up contributions for spouses. Expanding HRAs, health reimbursement arrangements, where they can reimburse individual insurance premiums. Right now, if you sponsor an HRA, you probably don't allow employees to go out and buy their own individual policies. That creates some HIPAA non-discrimination issues and other kind of concerns, legal concerns. Fuddy-duddy lawyers like me tell you not to do that. But this would kind of flip that rule and say, don't listen to the old lawyers here. You can ignore them. You can go ahead with this. So now, interestingly, that idea actually recently became law. It was kind of stuck into the 21st Century Cures Act, which we'll talk about later, at least with regard to small employers. Those who have less than 50 full-time employees, they can have these QSARAs, Qualified Small Employer HRAs. The QSARAs can actually be used to buy individual policies from the employees. The next concept that Republicans have to wrestle with here is dealing with adverse selection. Adverse selection is the concept that if you go without health insurance, but then rush down to buy health insurance once you get sick, the insurers take a beating, right? If I know that I've got a knee replacement that I need to have in 6 months, I wait 5.5 months, then I go out and buy health insurance, I get my knee replacement covered for 1 month, and then I stop paying, insurers get killed. So ACA kind of deals with that through the individual mandate. We also have kind of continuous coverage. Republicans don't like the individual mandate. They replace it with a continuous coverage rule. Paul Ryan doesn't have a number associated with it, but what he says is that if you have a gap in coverage, then when you go back to apply for coverage, again, I need knee surgery, I run down to buy coverage, the insurer can charge me more. Maybe it's 30% more, maybe it's 50% more, maybe it's 100% more. But again, the insurer should have some ability to charge me more to deal with the adverse selection risk. Also, the Ryan outline would cap the employee exclusion for employer-sponsored coverage. This is sort of a replacement of the Cadillac tax. The idea being that if you look at how much health plan coverage costs and how it's not taxed to your employees, that's the largest tax expenditure in the Internal Revenue Code, about $260 billion a year. Congress looks at this and says, you know, $260 billion is a lot. Boy, it'd be nice if somebody paid some taxes on that. Maybe we shouldn't be quite so generous. And so again, the idea is let's cap the value of that coverage. Under a draft of ACA, it would have capped it at about the 90th percentile level. So if you were in the top 10% in terms of being most generous, it would actually tax you on the value of that coverage. Paul Ryan plan didn't include a number here, and the final version of ACA dropped that 90% rule, but you can kind of see where Republicans are leaning in that idea. Healthcare backpack, universal advanceable refundable tax credits with no Medicare, no Medicaid, no employer offer. Again, the idea that people should have some assistance in terms of buying health plans here. Note 2, from an employer perspective, the last point on no employer offer. What this means from an employer perspective is that there's going to be some tracking of offers of coverage, right? Just like right now you have to track offers, you have to track who accepted, who's in the plan, et cetera. Under this Republican idea and under ACA, as we'll see later, you do have to track offers of coverage or whether people are actually eligible. So, you know, the 1094 forms, the 1095 forms may be going away as forms, but there's still going to be some kind of employer reporting, which is likely to be required in the future. Less detailed, maybe it's just who's eligible, who's offered, maybe not the whole ACA full-time concept, but this offer idea will be out there. All right, Empowering Patients First Act, introduced multiple times by Representative Tom Price, Republican of Georgia, now HHS Secretary. Similar to Speaker Ryan's plan, so we're just going to hit the highlights here again. Repeal the ACA, provide assistance to buy individual policies, which increase with age, but without any income cap. So, you know, the Warren Buffetts, the Bill Gateses would get federal assistance to buy health insurance policies. Expand HSAs, cap the employee exclusion for employer-provided coverage, repeal Medicaid, deal with adverse selection through continuous coverage, again, same as the Paul Ryan. Allow sale of insurance across state lines, again, the Donald Trump idea out there too. Patient Care Act, this is the one from the Senate, that's kind of the leading Senate one, which is out there. The other ones have been House related. This is a 2015 sort of an outline of a bill, again, more speaking points. There's no legislative text from some leading senators on the Republican side. Very similar concepts. Again, repeal the ACA, prohibit lifetime limits but not annual limits, allow that 3-to-1 ratio for insurers to move up to 5-to-1, then let the states handle it. Kids covered until age 26, adverse selection through HIPAA-like continuous coverage rules, and again, targeted tax credits for employees at small businesses or for large companies where the employer has no offer of coverage. Again, offers of coverage, employers would have to track that. And again, age-adjusted advanceable refundable tax credits. The one interesting thing here is at the bottom, the last bullet point, we finally get a number associated with the tax here. Cap employee income exclusion, $12,000 for individuals, $30,000 for families. So again, if the value of your coverage for an individual was $14,000, the individual would pay taxes on the difference between $14,000 and $12,000. So they pay income taxes on the $2,000 difference, which of course would inspire, I think, a lot of employers to try to keep the value of their coverage below those limits so that your employees wouldn't be hit with those taxes. All right, the goals, state goals of President Trump. He used to have a web page. I think it's gone. I can't find it anymore. But he used to have a Healthcare to Make America Great Again web page which talks about different ideas, very similar to what we've seen. Again, repeal the ACA, sale of insurance across state lines. Individuals can fully deduct their health insurance premiums, expanding use of HSAs, provider price transparency, again, very helpful if you have HSAs, block grants to Medicaid states, allow importation of prescription drugs. He's also stated in different contexts that he wants to have insurance for everybody. They sort of are liberal in this area. He wants much lower deductibles, and he says he's not going to cut Medicare or Medicaid, even though other Republicans want to.